All right, so we're going to jump back into the status of mental health in Ottawa document published by Ottawa Public Health. This is the section entitled Community Determinants. Sometimes poor mental health leads to poor social ties, while positive social relationships are beneficial for mental health promotion. Participation in community and social networks can help promote positive psychological well-being, sense of community belonging, recognition of security and self-worth, and enhanced access to social and societal supports to increase resilience against stressors. This section will focus on community involvement, social networks, social support, school and work environments, and the neighborhood social and built environment. Highlights for Ottawa. While many grades 7 to 12 students felt their school is a safe place, 91%, felt part of their school, 83%, and felt close to people at their school, 84%. More than 1 in 10, 12%, students were worried about being harmed or threatened at school. 1 in 5, 18%, students reported being bullied at school in the past year, and 1 in 5, 18%, reported being cyberbullied. Grades 7 to 12 students living with poor mental health and low family socioeconomic status were less likely to report feeling a part of the school or feeling close to people at school. 1 in 6, 17%, grades 7 to 12 students reported using social media more than 5 hours every day, and 84% use social media daily. 1/4, 26% of adults felt that most days at work were quite a bit or extremely stressful. 1 in 10, 11% residents felt the crime rate in their neighborhood made it unsafe to go on walks at night. Community involvement appears to have a positive effect on mental health, likely because of the relationship with social contact and self-efficacy. Community involvement includes civic engagement in local or national affairs and social participation, such as parents volunteering at their children's school or joining the club. In 2013 and 14, 67% of Ontario adults aged 18 years and older reported that they were a member or participant of at least one recreational or professional organization, group association, or club. This was higher than the national average of 64%. Canadians with higher levels of education and income were more likely to report being a member or participant of a group. Recent immigrants were less likely to report being a member or participant of a group overall, particularly with sports and recreational organizations. However, participation with religious affiliated groups was higher for immigrants compared to non-immigrants. 89% of Canadian students in grades 6 to 10 reported that they were involved in at least one club, organization, activity, or group. The majority, 94%, of Ontario adults aged 45 years and older reported they participated in social activities at least once a month. As age increased, monthly social participation decreased slightly, 45 to 64 years, 95%, 65 to 84 years, 92%, 85 years and older, 86%. That's a breakdown. Social networks. Social networks are the connections that people have between their family and friends. In 2013, 6% of Ontario residents reported having no close friends, people who are non-relatives that they can talk to about what's on their mind or call on for help. 39% reported having 1 to 4 close friends, and 53% reported having 5 or more close friends. Few, 4%, Ontario residents reported having no close relatives. In 2013, 7 in 10 Canadian internet users aged 15 years and older accessed a social networking site. Use of social networking sites was more common among young people. In 2017, 1 in 6, 17%, Ottawa students in grades 7 to 12 reported using social media sites for more than 5 hours every day, while only 8% reported no use. More than 4 in 5, 84%, students reported using social media sites daily. Girls and grade 9 to 12 students reported more use of social media sites. In previous research, students who reported an unmet need for mental health support, poor mental health, and experiences of high levels of psychological distress and suicidal ideation were more likely to report using social networking sites for more than 2 hours every day. Social support. Social supports are emotional connections and physical or financial assistance provided by individuals, friends, families, organizations, and government. Within populations, higher levels of social supports have been related to better mental health outcomes and perceived health. Workplace environment. The workplace is where many people spend a large portion of their waking hours. The work environment can affect mental health through organizational policies and the level of stress experienced. Relationships with co-workers, including bullying behaviors, also affect the mental health of workers. However, data characterizing these relationships are not readily available. Mental health is a frequent reason for missed work, yet only 1/4 of Canadian workers would feel comfortable talking to their employers about a mental health issue. Literature has shown that there is an economic return on investment when comprehensive workplace health promotion programs and stress management projects are implemented at individual and organizational levels. For every $1 spent on mental health and wellness, $9 are saved in decreased absenteeism. In 2016, there were more than 500,000 Ottawa residents over 15 years of age in the labor force, working for almost 270,000 employers. The top 3 sectors in Ottawa include sales and service, business, finance and administration, and education, law and social, community and government services. A 2016 situational assessment survey conducted by Ottawa Public Health with 139 workplaces found that mental health was their top health issue. Stress, work-life balance, and depression were identified as the main concerns. So we're going to pick it up again in another episode. The rest about workplace, mental health, stress, harassment, and so on. And then we're going to get into school environment and neighborhoods and the built environment with this new format of more bite-sized pieces of info. All right, peace.